as a public health problem in a speech to members of the National Press Club. Then at 4:15, Texas Congressman Richard Armey joins us to discuss the health care plans being proposed by Republicans. Now for the next 20 minutes, we take you to Dartmouth College in Hanover, New Hampshire, where today First Lady Hillary Rodham Clinton talked about health care reform.
I must begin by telling Mrs. Clinton that this is the eve of exam period, and any turnout of this kind on the eve of exam period is a tremendous indication of your respect and affection for the First Lady. Before I introduce Mrs. Clinton, I'd like to begin by introducing Congressman Bernard Sanders of Vermont. Congressman Sanders. And I would like to introduce a graduate of Yale who is a very good friend. Who is a very good friend of Dartmouth, and that's our Congressman, Representative Dick Swett.
Thank you very much. Don't take too much time away from the First Lady. I want to be very brief. I do realize that Yale was nice enough to let Dartmouth win this year. But I want to say just a couple of things. Number one, I want to thank Dartmouth and especially President Friedman for making this visit of the First Ladies so productive and so warm and so welcoming. And it's really a tribute to the student population as well as to the faculty and the administration that you could set such a wonderful place as the northern New Hampshire town of Hanover to welcome someone who has done such tremendous work in healthcare reform as the First Lady. I have had a great deal of experience with Yale. It goes back a long time, but I've also had some experience with the administration. And you know, I might say with my tongue firmly planted in my cheek that I have sometimes been a thorn in the side of the administration. I want the First Lady to understand I love and respect everything that the President and she have done. They have encouraged me to use open and very honest debate. And there's nothing better for removing thorns and sides than a little health care reform. That's why I'm announcing today that I'm going to be the 101st co-sponsor of the President's health care reform package. It's an honor to do so. I'm very pleased and proud to be associated with such credible and important work that the administration is carrying forward. And I'm very grateful for the opportunity to be here with the First Lady today to listen to her tell you, me, and the rest of the world why this is so important to this country. Lastly, for the press, I will be out on the balcony at Alumni Hall. Right after this, we can talk about my decision and my plans at that time. Thank you very much.
In February 1992, Mrs. Clinton spoke at Dartmouth in the Hinman Forum in the Rockefeller Center and announced on that day that if Governor Clinton was elected president, she would return to speak at Dartmouth. She is today keeping that promise. We are delighted to welcome Mrs. Clinton for a second time to Dartmouth, and we hope that she'll be here many, many more times besides. Hillary Rodham Clinton.
you. Thank you all. Thank you so much. This is such a treat. I had looked forward to coming back to Dartmouth, and it gives me such a real thrill to be here with you, although I have to correct President Friedman for the second time today. Earlier he introduced me and said I had been at Dartmouth back in February of '92 for my second visit, and that was my first visit. This is my second visit. And I told the crowd then that that doesn't count all the visits I used to make to Dartmouth when I was at Wellesley, back in the far distant past, when, in fact, I remember my very first visit to Dartmouth. I came up for some kind of meeting that Dartmouth was holding, and I also came for Winter Carnival, but that was later. This was for the meeting, and I came to the meeting, and the meeting was being run, and we were all being organized by Bobby Reich, who is still organizing America, one of your most distinguished alums and the Secretary of Labor. And I will never forget, we had this incredible discussion, and that was before there were any women at Dartmouth, at least in the college. And so I must say that I had never had a better time, those of us who came to this meeting that Bobby Reich put on, because there were about 10 of us and about 400 of you all, so it was great. But it's a real treat to be back, and especially for this occasion, because what we are trying to do is to make good on what we said during the campaign, when so many of you here at the college worked for my husband's candidacy, both in the primary and then in the general election, because you shared with us what we saw as a real historic opportunity, a chance to begin to deal with a lot of the problems in our country, a chance to have a new vision of what it would mean to be a strong, productive America in the 21st century, how we could ensure that this country, which has given us all so much, would continue to provide the opportunity that you deserve to have. And in the past year, we have worked very hard to build on that vision. And we're very proud of the record of legislative accomplishment and the changes that have already begun. I don't think there is any program that is dearer to the President's heart and in which he feels more promise than the National Service Bill, which was passed and signed into law, which will begin next year, providing opportunities for young people to do national service and for thousands to begin to finance their way through college because they're willing to do service to America. That's what a new America vision means. But part of what still lies before us is to tackle a problem that is really one that has developed over decades, but which threatens to undermine one of the strongest parts of our national heritage. There isn't any doubt that America has the finest medical system in the world, if you can afford to use it, if you can get there, if you can take advantage of what it has to offer. There's also no doubt that for those who are well insured, there is a certain sense of being taken care of. But increasingly, even for those of us who are insured, there is no security. Every month, 2.25 million Americans lose their health insurance. And usually they lose it because they change jobs or they're laid off or the business they were working for no longer will provide health care. But sometimes it's because all of a sudden they can't be insured because they've got an illness or a child has a problem that nobody wants to take care of. And so even for those of us who are insured, there isn't any real health security. And what the President is absolutely committed to doing is providing health care reform that first and foremost gives every one of you the absolute confidence that no matter who you work for, no matter where you live, no matter whether you have a pre-existing condition, which is insurance language for having been sick and maybe still having something you have to take care of like diabetes, that you will always, always be able to afford to have your health care needs met. I'm very grateful for the leadership that many people are giving to this great reform effort. And I'm grateful that Congressman Sanders would join us today from Vermont. And I am particularly pleased that Congressman Sweat would announce his endorsement of the health care reform, the Health Security Act, today here at his home state. But you know, there has been efforts in the past to reform our health care system. This is not a problem that is new. Back in the days of your grandparents and great-grandparents, Franklin Roosevelt thought that he would do Social Security, which would lift millions and millions of Americans in their older years out of abject poverty, and then he would do health security, but he couldn't get it done. And then President Truman came along, and in 1945 he said, we have to make sure that every person in America has health insurance, no matter what their race or their residence or their economic status is. But he tried in 1945, he tried in 1947, and he couldn't get it done because there were so many interests that said, why do we need to do that? We don't need to worry about that now. And then in the 1960s, President Johnson was able to get through both Medicare and Medicaid, two programs that have made a huge difference in the lives of millions of Americans. Many of your grandparents, my parents, were on Medicare, which enabled them to deal in my father's last days with very severe hospitalization and medical costs, and knowing that they wouldn't have to sell their house, that they wouldn't go bankrupt. They'd have to pay something, but it wasn't going to destroy what they had saved all those years. And now we know that the changes that were made then made this a more humane and better society for the very poor and for the elderly. President Nixon tried to get health care reform through in the early 1970s, and again, it didn't go anywhere. Now is the time. Yes, there will be great discussion in our country for the next months, and I am thrilled to see some of these signs where clearly people are in the campuses around America becoming involved and interested in what health care security will mean to them. I remember very well when I was in college, I didn't think about health insurance. It wasn't something that was on the top of my mind. I didn't realize that, you know, I might need it someday. And it wasn't really until I was married, and probably not really until I was a parent, that I began to understand what it would mean to me if I didn't have health insurance, and what it means to millions of Americans every day. I just want to tell you just a very few little stories that may reflect something of your own experience about why this is important for everybody. Because remember, what we are trying to do is not just to take care of those people who get up every day and go to work. I bet some of your families fall into this category. But they don't make quite enough money to be able to afford insurance, and their employers don't help them. They are uninsured. Yes, we're going to make sure every American is insured, but the only way we can do that is by ensuring that every American always has health care benefits. I don't want in the next years to go around our country and to talk to the people I've talked with the stories they have to tell me. I sat in the living room of a small farmhouse in Iowa with 4 farm families who opened their books to show me what it cost them to try to keep health insurance and try to make a living on the farm. There was one family, because the father had an accident on the farm and one of their children had diabetes, they were paying $9,000 a year for health insurance. That was as much as they made from their farm on some years. And I've been in New Orleans talking to people who've worked all their lives for the same company but never could afford insurance. And I've had a woman look at me and say, I've worked here 15 years and I've always tried to take care of myself. And every year I go and get a physical and I pay for it out of my own pocket because I want to stay healthy. But last year, she said, the doctor found a lump in my breast and sent me to the surgeon. The surgeon said, you know, if you had insurance, we would biopsy it, but since you don't, why don't we just watch it? And I thought to myself, what if that had been me, or my mother, or my friend? And I've talked to small business people who can't get insurance in today's market without paying an exorbitant amount of money, because we discriminate against small business people. And I've looked at a mother and a father who had left their jobs where they had insurance because they wanted to start a small business, but now they couldn't afford insurance. And the mother said she had told her 2 sons, don't play sports this year, boys, because if you get hurt, we can't afford it. And I've talked to another small business person who insures his family and his 4 employees and their family. And then all of a sudden, one of his longtime employees had a child with Down syndrome, like the young man whose hand I shook as I was coming through the corridor there, working here, making his contribution to Dartmouth. But this man, when he was faced with the insurance company that said, you know, we're going to have to raise your rates really high because you've got this employee with a Down syndrome child, and my friend said, well, what can I do about that? And the agent said, well, you can fire him. That shouldn't be a choice anybody has to make. Those are the stories that are made every day in America that move us to say we can do better than this. We know this is the smartest, richest, strongest, best nation in the world in solving problems, and it's about time we put our minds to work and solved this one. And once we solve it, we will have provided health security for every American, no matter who they are, where they live, who they work for, or whatever happens to them. But we would have done something else. We would have made a statement about what our values are as a people. We would have said that, you know, it's time we got back to taking care of each other in this country. It's time we viewed each other as members of a great extended community, and where some of us maybe can help out a little bit to make sure people get taken care of. We want to do that because there, but for the grace of God, go you or I. So this is a debate about health care. And I hope you will read this book, which is going to be in the library, it'll be in the bookstore, and I'll give this to President Friedman to have available. But more than that, I hope you will think about what we are trying to achieve in our country and what opportunities there are for your generation to be engaged in making sure we are always, always on the cutting edge of change and promise and possibility, and that America lives up to its promise to you the way it did for me and my husband. Thank you all very much. Oh, thanks.
Wait a second. Good. Yeah, good. Mrs. Clinton, on behalf of all of Dartmouth students, I'd like to present you with this gift.
Can I open it up?
You can.
Oh,
It
great.
opens right up.
Oh, great. Oh, great. Oh, that's terrific. Thank you. Well, thank you, President Friedman, and I want to give you these copies, and I want to assure you that we cannot get this done without the big green behind us, so you all have got to be there. Thank you.
Oh, I think you can go anywhere. Anywhere you want.
By all means. Thanks so much for being here. It's a pleasure. Let me just give these to Mike.
President Clinton's health care plan is designed to provide universal health coverage to all Americans by the end of 1997. It also aims to bring health care costs under control by limiting Medicare and Medicaid spending and by setting an average price for health care premiums.